tumor regression and allograft regression after administration of anti-PD-1. Around antibodies against the programmed one PD-1 receptor and one of its ligands, PD-L1, have produced tumor regression in multiple cancer types. These therapies are untested in patients treated with long-term immunosuppressive medications. Here, we report a case in which PD-1 antibody was administered to a solid organ transplanted recipient with metastatic cutaneous squamous cell carcinoma. The patient had a robust anti-tumor response along with allograft regression. This case suggests that anti-PD-1 can be highly effective against cancer arising in the context of chronic immunosuppression. It also suggests that the PD-1 pathway may be critical in maintaining the partial tolerance that prevents T-cells mediated allograft regression. Clinical case: a 57-year-old woman underwent kidney transplantation for a decreased donor in 1989. She received standard long-term immunosuppression, including cyclosporine and prednisone. She presented with metastatic cutaneous squamous cell carcinoma in March 2014. Kidney function remained stable after reduction of immunosuppression to 5 mg of prednisone daily. Her cutaneous squamous cell carcinoma progressed first during cetuximab therapy and then during trametinib therapy. Her tumor contains a loss of function mutations in NF1. Kidney function remained stable after reduction of immunosuppression to 5 mg of prednisone daily. Her cutaneous squamous cell carcinoma progressed first during cetuximab therapy and then during trametinib therapy. Her tumor contained a loss of function mutation in NF1. Administration of anti-PD-1 was then considered on the basis of her poor candidacy of cytotoxic chemotherapy. Performance status of 2 on a 5-point scale with higher score indicated greater disability. A 2 years overall survival rate of 14% among patients with metastatic cutaneous squamous cell carcinoma. An ex vivo analysis of cutaneous squamous cell carcinoma in solid organ transplant recipients showing expression of PD-1 and its ligands, a finding that in other tumor histological types is associated with an increased likelihood of response to PD-1 blockade. The risk of immune-related toxic effects associated with anti-PD-1, including kidney allograft regression, were explicitly conveyed to the patients with the endorsement of a virtual tumor board convened to evaluate relative risks and benefits. She began February bevacizumab anti-PD-1 in September 2014. 2 months after indication of anti-PD-1, the patient had acute allograft regression, despite administration of high-dose glucocorticoids. The patient transplant kidney did not recover. Histological and immunohistochemical evaluation of the explanted kidney-relevant, severe, acute, and chronic cell-mediated regression. The patient cutaneous squamous cell carcinoma expressed PD-L1 on tumor cells and infiltrating immune cells. Expression was especially associated with an activated CD8 positive cytotoxic T cells response, including lymphocytes expressing PD-L2 and PD-1. Computed tomography performed 8 months after the initial of pembrolizumab revealed a 85% reduction in a tumor burden. The patient has not had autoimmune toxic effects. She is undergoing hemodialysis without unacceptable adverse events, and her echo performance status has returned to 0. Thank you.